Bonitas was founded in 1982 as medical aid for Black civil servants. Since then, we have continued to be agile. We've also become an open medical scheme to allow more members and inclusivity of all South Africans onto the medical scheme. We are now officially the second largest medical scheme in South Africa, representing and being entrusted with over 730,000 lives.
Medical aid, it's a must-have. The good thing about medical aid is that they pay, and then that gives us the opportunity as well to go to private hospitals. That's my wife there, you know. That's how she looked like then, you know. She was so tiny. It happened in the 1980s. We didn't know what it was, but at least now we know that she had bipolar. We were referred to a specialist who did all the tests. She was given medication, and that condition has been controlled ever since. And it's a chronic thing, and Bonitas continues to pay for that. So we don't have an issue with medication. To tell the truth, I tried, you know, doing some research from other medical aids, you know, just to compare, but they couldn't come closer to Bonitas. If I look back, you know, on what they did for us, I decided that, no, I'm not gonna leave Bonitas.
As Bonitas Medical Fund, we have put trust as a value set in the center of all that we do. But trust is meaningless without action.
Where are they? I think I was 9, 10, and I must have eaten something. And then I got an allergy reaction. I remember my parents rushing me to the hospital. I was so scared, but I knew that I was in the right hands. I knew that everything was covered in terms of medical aid because my parents used Bonitas from a long time ago. When I started working, my employer offered me a variety of medical aid schemes. I remember I picked up the phone like, Dad, so I'm supposed to choose a medical scheme. He's like, but you know, we've always been using Bonitas. That peace of mind is worth $1 million because I know that my family's health needs are taken care of.
We have recently, over the last 2 years, introduced new options to speak to the need of our younger members who consumes healthcare in a very different way.
Bonitas is very modern. For instance, you have virtual GPs, you can have an e-card, which is your membership card, which you can have on your smartphone. So for a young professional, I mean, that's very convenient. We are a much more technologically advanced kind of generation, so we want everything that's embedded onto our phones or on our iPads or wherever. And being able to easily access those kind of things makes it very convenient for the member.
Bonitas is a type of medical aid scheme that understands the healthcare needs of its members. Whether you are a blue-collar employee, whether you are a white-collar employee, or you are an executive or a CEO, it fits everybody. The benefits are straightforward, no nonsense about them. What you see is what you get.
During the COVID-19 pandemic, Bonitas Medical Fund had to become more innovative than what it used to be, specifically in relation to home-based care, because many people were fearful of actually entering a normal healthcare facility.
Cure Medical is a digital health company pioneering premium healthcare solutions. Our flagship offering is the technology-enabled hospital at home. So it combines minute-by-minute continuous vital sign monitoring together with virtual and in-person visits to bring hospital-level care to the patient's home. Bonitas was one of the earliest adopters of our offering. They immediately understood our vision. We've seen a real willingness from Bonitas to take risks and to try new things in order to benefit their members.
I'm proud to be associated with the brand because the people, service providers, our board of trustees embraces the philosophy of truly making a difference. That for me is heartwarming, and it feels that it's a purpose-driven life that you do through your profession. But more so that as a father, you have made a difference to another family member.